Hierarchical Condition Category, or HCC, is a payment methodology based on risk used by CMS to adjust Medicare Advantage health plan payments at the patient level. This means that two patients within the same community can have a different payment rate based on several factors related primarily to the amount of risk or work it takes to maintain the health of a patient. Risk adjustment allows CMS to pay plans based on the risk of the beneficiaries they enroll, instead of an average amount for Medicare beneficiaries. By risk adjusting plan payments, CMS says it is able to make appropriate and accurate payments for enrollees with differences in expected costs. Risk scores measure individual beneficiaries' relative health, and risk scores are used to adjust payments for each beneficiary's expected expenditures. Several factors impact the risk score, but primarily, the HCC risk adjustment is based on their demographic characteristics in a broad picture of their health, including all their diagnoses. The combination of the health status plus the demographic characteristics determine the patient's raw risk score. As our system and the clinically integrated network begins to explore value-based payments, HCCs will play a critical role in managed care companies by setting an appropriate benchmark for the health of our population. These benchmarks are used to set both quality and financial benchmarks. Today we will hear from Carol Jank, a health information technology specialist at the Fort Drum Regional Health Planning Organization. Carol works with providers in the Tug Hill Seaway region to help meet guidelines for payment incentives. In this video, Carol will explain risk adjustment and how hierarchical condition category is used to create a risk score.
Hierarchical condition category. What is risk adjustment? Risk adjustment adjusts payments based on an expected health care cost. It promotes equal access for patients and reduces adverse selection of patients who providers really don't want to see. They're hard to deal with, have multiple comorbidities, and take up a lot of time. Risk adjustment utilizes multiple models to predict the cost of different benefits, for example, Medicare Part C and D. It also incorporates both demographic and disease factors. It uses diagnoses to predict the following year's costs. So, what is a 1.0 risk score? A risk score of 1.0 represents average annual Medicare cost for an individual. A risk score higher than 1 means the individual is likely to incur cost higher than average. A risk score lower than 1 means the individual is likely to incur a lower cost than average for the next year. Some of the demographic factors in a risk adjustment are age, sex, disability status. Are they disabled? Are the original reason for entitlement? Have they been disabled? Is that why they were originally put on Medicare, or were they aged into Medicare? Are they on Medicaid? Are they institutionalized, such as a nursing home? Some risk scores we're just going to show you so that you can compare, the difference between somebody who's young, male, female, whether they're in the community or they're institutionalized. So our first slide shows 35 to 44. Next is 65 to 69. The last is 80 to 84. And don't forget, there's an additional risk added onto these for patients on Medicare and or who are disabled. The other part is the diagnostic characteristics. Disease groups contain major diseases and are broadly organized into body systems. Disease groups are referred to as hierarchical condition categories, or HCCs. There are currently 70 HCCs in the Medicare model. HCCs are assigned to a disease, and it is determined by the ICD-9 or ICD-10 diagnosis code submitted during a data collection period. Only selected diagnoses are included in the risk adjustment model. and Medicare gathers these diagnoses from claims submitted in the past calendar year. The top diagnostic groups are HCCs by the risk factor are pressure ulcers of skin with necrosis through to muscle, tendon, or bone, metastatic cancer and acute leukemia, respiratory dependency, tracheostomy status, arteriosclerosis of the extremities with ulceration or gangrene, and pressure ulcer of the skin with full thickness skin loss. Let's take an example. Diabetes is a common diagnosis, and there are 3 HCCs associated with diabetes. Diabetes with acute complications, diabetes with chronic complications, and diabetes without complications. And if you look at the difference in the risk factor between your diabetes without complications in the community and diabetes with complications who is institutionalized, you have a 3 times risk factor for patients who are institutionalized with complications. So we have this website, and it will actually calculate HCCs for you, so we can do a few examples. Olga Jones is born in July of 1932, and she's coming in complaining of fatigue and chest congestion. For her assessment, the only line is acute upper respiratory infection with flu, 487.1. Remember, this past year we've been using ICD-9 codes, not ICD-10, which have just gone into effect. So we put the payment year of 2015. We put in, her birth date, that she's female, she lives on her own, and she does not have Medicare, and she is not disabled. Her diagnosis, the 487.1. Note, there is no risk score. There is no risk in having an upper respiratory infection. And if you note on the bottom, her total risk factor is 0.509. She's not at high risk to have extended health care costs for the next year. So let's go back and look at Olga again. And we've added more to her note. We note that she has diabetes, taking insulin for it. So now her assessment adds the diabetic code 250.00, diabetes unspecified, not stated as uncontrolled. And if you add that in, if you note now, there is a risk score under the diabetes, and her blended total risk factor is 0.628. So it is an increase, but it is still less than average. So now let's put all of Olga's information in for a more complete note. And when you read this more complete note, you note that she has the upper respiratory infection, diabetes, but with peripheral circulatory disorders. So she has a complication. She also has an ulcer, CHF, and ASCVD. When you enter those into the model, you will note that all of these, except for the 414.00 for the ASCVD, have additional risk factors. And when you look at her blended risk factor, it's 2.103, much higher. You will note that there is a additional risk included when you have more than one comorbidity, such as diabetes and CHF. So, what do we know now? We know that risk adjustment adjusts payments based on expected healthcare costs. It's based both on demographic and diagnostic factors. There are 70 HCCs, and detailed and complete documentation and billing is critical to capture an accurate risk factor for a patient, which is what reimbursement is based on.